Today, I will be going through a platform overview and demo of the SPICE 2.0 application. SPICE is a comprehensive digital public good focused on integrated longitudinal primary care. And within the SPICE ecosystem, there are four main components. SPICE Community, which is a comprehensive community health worker platform with a bidirectional linkage to facility-based care. SPICE Facility is a light touch EMR with comprehensive clinical workflows that are specifically designed for low resource settings. And today in the demonstration, I'll be going through how SPICE Community and SPICE Facility work seamless with each other to enable end-to-end care from the community to the facility. Today, I'll also be going through SPICE Insights, which is our FHIR and standards-based data analytics platform that we are looking to enhance into a robust standalone product to be used with other health management information systems. And lastly, SPICE Clinical, in which we are building a future clinical logic engine, hoping to establish a new category of global good. And in this effort, we are working with several partners to move forward with this vision and idea. Introducing SPICE 2.0, which we have been building to be the next generation primary care platform. What makes SPICE 2.0 unique is the disease pathways are algorithm driven and it contains closed loop, risk-based follow-up of patients at the community and facility levels. The platform also provides advanced administrative features, customized dashboards for users at all levels of the health system, including monthly summary reports that integrate into larger national reporting systems such as DHIS2. In addition, we have real-time outcomes tracking by each disease area, providing operational KPIs at every level, visualizing the data in order for stakeholders to make data-driven decisions off of this platform. We are really looking with SPICE 2.0 to reimagine primary care to integrate across disease areas, with horizontal integration at the primary care level. SPICE 2.0 has clinical workflows enabled for maternal and child health, tuberculosis, HIV, malaria, hypertension and diabetes, as well as mental health and immunization workflows. SPICE also supports users at every level of the health system to harmonize that primary care. Today in the demonstration, you'll see what it looks like for a community health worker to screen, refer, and manage patients in the community, as well as what it looks like for a doctor or nurse to conduct a medical review, diagnose any conditions, prescribe medications, and so forth. Health system roles that are also supported include peer supervisors, facility administrators, all the way up to National Ministry of Health stakeholders that can leverage this data to manage population health and set their policy agendas. This service blueprint will come to light more as I dive into the live demo. But at its core, it enables a patient to move from community-based screening with a referral to a facility for a medical review that clinician can conduct. Then the unique piece here is upon receiving their medical review and diagnosis, the application using risk stratification and algorithm-driven treatment plans creates a customized treatment plan for that patient and individual, with that counter referral back to the community-based case management, in which a patient can receive home visits from a community health worker, as well as reminders, all of this ensuring that community health workers are following up based on that algorithm-driven plan, and that clinician sees visibility of patient data that's collected at that community level, further building out that longitudinal patient record. And this linkage continues to repeat from the community-based assessments to those facility visits and medical reviews. Lastly, before jumping into the demo, we wanted to highlight that the SPICE platform is now FHIR-enabled, with FHIR native elements that allow for enhanced platform interoperability. This allows the SPICE platform through the adoption of the WHO SMART guidelines. And we believe that this is incredibly important for enhanced interoperability with SPICE and other systems to support the vision of a really thriving digital ecosystem. And so with that, I will jump directly into the demo of SPICE 2.0. To start out and following with that service blueprint, I will be logging into the application as a community health worker. And so upon logging in, as a community health worker, I have two options. I can look at my households, and I can also look at my patients list. To start, I will show what it looks like to perform a household registration. So you can see in this training environment, as a community health worker, there's 288 households that are registered that I alone have visibility to, along with other community health workers in my district. And so I can choose to add a household. At this point, we collect patient consent. This patient can then provide their e-signature or enter in any initials. At this point, we will be collecting household information. And so in this case, this is the Balma household. We select the village and any landmark information. Collect a household head mobile number, along with the number of people in the household, and some basic information such as whether or not they own a latrine, a hand washing facility, and a permit. Upon collecting this information, we'll collect the head of the household's information. We can select that this is the personal mobile number category, and then select their date of birth, and gender. At this point, I will go ahead and submit that. And now you can see I have 1 out of 3 members of this household completely registered. I'll go ahead and add a new member. Who's the spouse. In this case, it's going to ask if she is pregnant. We will say yes. And then lastly, we'll add the third member of their household. Who's their son or daughter. So at this point, I have my household completely registered, and I have the ability to start an assessment on any of these individual household users. So in this case, I'll start the assessment for Ben. I have the ability to assess him for any symptoms that he might be showing. In this case, he's experiencing no symptoms in that list, but he is experiencing a fever of 38.7 that has been going on for 4 days. We did not take an RDT test, so we'll go ahead and submit. You can see, based off of the number of days of the fever, as well as the temperature, that Ben has been referred for further assessment to the health facility. We will select the nearest health facility, which is the General Care Hospital, and this referral ticket gets created for Ben. At this point, I would also have the ability to assess another member of that household. And so in this case, we found that Bethany was pregnant. And so we would be able to complete the first ANC flow. She's not having any of these danger signs. Male partner is present. She does not sleep under a bed net. And we're answering all of these specific questions. At this point, based on this ANC assessment, there's no referral or no further treatment that's required. So we'll go ahead and complete that registration. As a community health worker, I could continue to assess patients as I move from household to household. And you can see here, I have my household list with the ability to filter it based off of the registration status as well as the village. I also have the ability to do that patient prioritized follow-up by the My Patients. And so you can see here in this list, the patients are stratified based off of the priority for follow-up. And so you can see here that we have a patient status, that they are on treatment for malaria, and the follow-up for this individual is 26 days overview. With this, I have the ability to directly call this patient, and I can complete the action using the phone or any dialer that's installed on the tablet. After the call was completed, I can say what the call results was, whether it was successful or unsuccessful, and if the patient was recovered, on treatment, or referred. In this case, let's say that this was unsuccessful and it was an unreachable call. You can see there, based on the fact that my call was unsuccessful, that this patient remains on the top of that list. So I still have them as an individual that I need to follow up with. Let's say for the second patient, I have actually visited their household. In that case, we have the opportunity with this icon here to immediately perform an assessment. And now I won't go through that entire workflow, but this shows and demonstrates what it looks like from the community health worker's perspective to either call and directly follow up with or perform an assessment on this individual. And now, an important thing to note within the community-based workflows is that the application operates entirely offline. This is important as we look to track these patients from the community to the facility. And so for the purposes of the demo, I'm going to go ahead and start an offline sync for the data that was just collected. Now, if I was a community health worker and I've logged out of the application, regained connectivity, and logged back in, this data would automatically sync the very first time that I log in to the application with a connection. So I'll go ahead and sync this offline data. Great, so my offline data has been successfully synced in the application. I'm now going to demonstrate what it looks like for a clinical user to assess a patient at that facility level. And so in this case, I will be logging in as a doctor. And the first thing that you'll notice is that the interface looks different. And so as a clinician, I have the ability to perform medical reviews on these patients as they have come into the facility. I have the ability to filter this list based off of the patient status. And in this case, I will filter the list based off of patients that are referred for further treatment. And so you can see here, I've got a list of 95 patients that have been referred for further treatment. And up here on the top right is the patient Ben that I just performed that community-based registration of the household and assessment. And so you can see here within Ben's medical record is the referral ticket. You can see Ben was referred for for fever, and the date of onset was the 16th of October. Because it was a new registration, we don't have any medical review or investigation history, but as the patient continues to interact with the health system through the community-based assessments and the facility-based reviews, this medical history will begin to populate in the patient's record. And so in this case, I have the ability to start a medical review. And at this point, I'm going to go through the general screener. I have the ability to look at what are the presenting complications, as well as adding in any diagnoses. In this case, let's say I've confirmed with a positive RDT test malaria. And I can continue my medical assessment. In this case, let's say I've done a systemic evaluation of cardiovascular as well as respiratory system, and I can type in any clinical notes. Fever, Once this has been submitted, you can now see that Ben's patient status has changed to on treatment. We can also say recovered once that patient has been recovered. Say any medical supplies that were used, any cost information, and then what that next visit day should be. So let's say we want him in the next week to understand if there's been progress. At this point, I am done and my review has been submitted successfully. And as that provider, I have the opportunity to go through and assess any additional patients through that medical review workflow. The last piece that I'd like to demonstrate is the administrative portal with those monthly summary reports, as well as the Insights dashboard. And so as an administrator, I have the ability within the admin portal to add users, change passwords, and set up new health facilities all through this system functionality. You can see here, I have the ability to select different regions, add in different health facilities, and manage my users. Within the SPICE reports, this is where you'll find those monthly summary reports. And these reports can be customized for any specific instance. In this case, you can see the HF1 report for the month of September for this specific health facility that's looking at any of the different fever cases that have been reported. This report can be viewed as well as downloaded from a summary perspective, as well as these can be integrated to be able to send to national level DHIS2 systems. The other piece of the portal is the access to dashboards and insights. In this case, I'm going to demonstrate what it looks like for a malaria dashboard. You can see here, there's an executive view where you can see summary and population health metrics, such as the number of suspected cases, referred cases, and RDT positive cases. We can also look at a facility view to look at these cases over time by age bracket, as well as which are the top 10 districts that have these positive cases. And then lastly, another interesting piece of this is the ability to visualize these cases from a mapping perspective. And so this is something that could be incredibly interesting from a national level health stakeholder. This is just one example of one of the dashboards within the SPICE Insights product.